Dacogen is a prescription medicine used to treat the symptoms of blood or bone marrow cancer, Myelodysplastic Syndromes. Dacogen may be used alone or with other medications. Dacogen belongs to a class of drugs called antineoplastics, DNA methylation inhibitor. Indications. Dacogen is used to treat myelodysplastic syndrome, a group of conditions in which the bone marrow produces blood cells that are mishappen and does not produce enough healthy blood cells. Dacogen is in a class of medications called hypomethylation agents. It works by helping the bone marrow produce normal blood cells and by killing abnormal cells in the bone marrow. How to use. Dacogen is given as an infusion anti-vein. A healthcare provider will give you this injection. In most cases, a Dacogen injection is given every 8 hours for 3 days. This 3-day treatment is usually repeated every 6 weeks, at least 4 times. You may be given other medications to prevent nausea or vomiting while you are receiving Dacogen. Dacogen affects your immune system. You may get infections more easily, even serious or fatal infections. Your doctor will need to examine you on a regular basis. Contraindications. To make sure Dacogen is safe, tell doctor if you have ever had kidney disease or liver disease. You may need to have a negative pregnancy test before starting this treatment. Dacogen can harm an unborn baby or cause birth defects if the mother or the father is using this medicine. If you are a woman, do not use Dacogen if you are pregnant. Use effective birth control to prevent pregnancy while you are using this medicine and for at least 6 months after your last dose. If you are a man, use effective birth control if your sex partner is able to get pregnant. Keep using birth control for at least 3 months after your last dose. Tell doctor right away if a pregnancy occurs while either the mother or the father is using Dacogen. Dacogen may affect fertility, ability to have children in men. However, to prevent pregnancy because Dacogen can harm an unborn baby. You should not breastfeed while using Dacogen and for at least 2 weeks after your last dose. Warnings. Dacogen affects your immune system. You may get infections more easily. Call a doctor if you have unusual bruising or bleeding or new signs of infection, fever, chills, cough, sore throat, trouble breathing. Before receiving a Dacogen injection, tell a doctor if you have liver or kidney disease. Don't use Dacogen if you are pregnant, it could harm the unborn baby. Use effective birth control and tell a doctor if you become pregnant during treatment. If a man fathers a child while using Dacogen, the baby may have birth defects. Use a condom to prevent pregnancy during your treatment. Continue using condoms for at least 2 months after you stop receiving this medicine. You should not breastfeed while you are receiving this medicine. Dacogen side effects. Get emergency medical help if you have signs of an allergic reaction to Dacogen, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Call a doctor at once if you have fever, chills, sore throat, mouth sores, red or swollen gums, skin sores. Easy bruising, unusual bleeding, purple or red spots on under your skin, pale skin, cold hands and feet, or cough with mucus, chest pain, feeling short of breath. Common Dacogen side effects include fever or other signs of infection.